Good afternoon, everybody. Happy Monday, and welcome to our COVID-19 briefing that we do Monday, Wednesday, and Friday in this community to share with you what's going on related to COVID-19 and give you updates as we have them. Over the past number of days, a lot, again, has been going on. Not a surprise, probably, to anybody listening to this, that this is constantly changing, and we are adjusting and moving and planning within those changes and responding as a community, knowing that we need to do that. The governor has said today and has said over the last couple of weeks that as we look at managing this disease and moving from where we are right now to where we need to go in the future, that it's about turning the dial and not flipping a switch. We're not going to magically change what's happening right now in our environment, and we need to be smart and strategic about that reopen and be smart and strategic about containing disease in an effective way once we do start reopening. Safe reopening and containment are going to be key words that you will hear over and over and over again. Today I'm going to give a brief Wisconsin update, share a little bit about what we've heard today with the new order that came out. I have partners from Chippewa and Dunn County again here today to share with you some of the things that are happening in their communities as well. And then I'll close with some additional Eau Claire perspective, and we can answer questions after that. In Wisconsin, there are now 36 labs doing COVID-19 testing with a daily capacity of 7,238 tests. There were 46,603 negative tests and 4,499 confirmed cases of COVID-19, an increase of 153 cases since Sunday. 1,211 hospitalizations, about 27% of the cases of COVID-19 positive cases have been hospitalized, and 230 individuals that have died, an increase of 10 since yesterday. Again, every death from this disease is a family, a grieving group of people that are dealing with a devastating disease. One of the key strategies as we move forward is testing. The state is continuing to ramp up testing and did have a number of announcements over the weekend and late last week, as well as today, about testing. They are continuing to ramp up testing capabilities. The past few weeks has increased the labs and the number of tests being done. They announced today that they are moving to 85,000 tests being able to be done per week in the state, and they're working with many partners on getting this to happen. If we want to open up, we need to be able to contain disease that starts happening with that opening up of our communities. And we want to open up, so we need to test, and testing capacity is critical. So the work that the state is doing is essential. They announced that Exact Sciences, one of the testing locations, is committed to 20,000 tests a week. Promega is a company that is working on supplying reagents and supplies to make sure testing can happen. Our own Marshfield Clinic Health System, which sits in our area but is based in Marshfield, has committed to increased lab testing over 10,000 a week for their system. And there is a state commitment and a process for accessing test collection supplies that is newly starting. There's also a state commitment and already the use of National Guard for some surge testing in places where there are significant outbreaks, Brown County being the most recent example of that. And those are the kinds of efforts that the state has already moved forward and will be critical as we move to the next steps. Emergency Order 31 was released this afternoon, titled Badger Bounce Back. It's a strategy to move from where we are right now with the Safer at Home order, both the current one and the one that starts later this week, and the Wisconsin Economic Development Corporation's Wisconsin Ready Plan. Those two documents were released today, and they outline our strategy and our metrics, how we are going to decide to move from one stage to the next. A clear walking forward in order to open our businesses and contain disease in an effective way. Again, during the governor's announcement of this, he talked about not flipping a switch. We can't safely do that and avoid a huge surge of disease. So our goal is to turn a dial, to move progressively, like the White House plan has outlined very clearly, to step through this using metrics and using a strategic process to get us to a point where we can safely interact in our communities the way all of us want to. The Badger Bounce Back Plan was based on guidance from the White House release of their plan last week. It's also based on a number of other documents that exist at a national level that really frame in a big picture way how to move from where we're at to moving forward. This is the Wisconsinized version of that, aligned very much in sync with that White House plan. Starts now, doing what we're doing now to make sure we don't spread disease. Moving through phases. So phase 1, when certain places can start being open, where there is very careful look at protecting employees and customers from being safe and using physical distancing, and opening those non-essential businesses for some minimal operations. Phase 2 is, again, the next step up. More businesses open, mass gatherings of up to 50 people, and resuming of more operations that we're used to in our community. Phase 3 would be really resuming all business and activity with some protective and preventive measures continuing in place. Certainly, in all of those phases, having a particular focus on our most vulnerable populations, particularly our elderly and those that are living in long-term care facilities, is going to be a continuing place of concern with a disease that none of us have protection against. And we have certain populations that are particularly at risk. The overall goal with this Badger Bounce Back Plan and with the work that WEDC is doing is to quickly and effectively move back to reopen. The goal is that we don't have challenges with workers and with work sites not being able to stay employed because they get sick. And the additional goal is that we have people in our community that can trust that they can go out and be safe when they visit places in the community. The metrics, or the ways to measure moving forward through those stages or those phases, have been identified by the state as well. So there's clear direction for when we can move from where we're at through to phase 1. We're not there yet as a state, and so we are watching that data, and all of us will be paying attention to when we can do that as quickly as possible. There's additional requirements that we also have to meet beyond those metrics, and we've talked about those in these conversations previously, but we need additional personal protective equipment, we need that testing capacity to increase, and then we need the case investigation. So when we have positives, we need to be able to investigate those thoroughly, and we need to be able to do the tracing of any contacts very diligently so we can, again, reopen and contain disease. Doing both of those things is going to be essential moving forward. So I am going to turn it over to Angie Weideman from Chippewa County. She's going to share a little bit about what's happening in Chippewa, and then Katie Gallagher from Dunn will also share, and then I'll be back to share a little bit about Eau Claire. Thank you very much.
Thank you, Liska. My name is Angie Weideman, and I'm the Public Health Director for Chippewa County Department of Public Health. I wanted to give a few status updates today from Chippewa County. First of all, we are at 20 confirmed positive cases, 755 negative cases, 17 pending cases, and there have been a total of 792 total tests given in our county. Last Friday, we did report that we had 21 positive cases and later found there was a human error in reporting, and we are currently at 20 positive cases. Today, I want to talk a little bit more about the formation of a recovery task force in Chippewa County. There are 4 phases in emergency management, and those include mitigation, preparedness, response, and recovery. We are currently in the response phase, and we have created a recovery task force to begin planning for the next phase, which is recovery. Recovery activities restore the community to a normal after a major incident. Sometimes after major incidents, there's a new normal, and pandemics do change people and communities. The Recovery Task Force helps everyone find and deal with their new normal. Our Recovery Task Force mission is to be an authoritative and comprehensive resource to the community and businesses as we begin to reopen our community in a safe and incremental fashion. The task force is led by Jack Hubweeb, who is the Health and Human Services Board Chair, and we also have representation from West Central Wisconsin Regional Planning Commission, the Chippewa Chamber, the City of Chippewa Falls, Chippewa County Recovery and Wellness, Public Health, the Town of Birch Creek, Emergency Management, Human Services, and UW Extension Agriculture Agent. The task force will continue to meet to determine how to remain compliant with the health recommendations and directives while supporting our community's economic, educational, agricultural, and commercial sectors. They will also consider mental and social health of the communities and people in the communities. The initial recovery stage will begin in the late stages of response. The transition from response to recovery, both timing and methods, must be carefully planned and implemented. We will get through this. With all of us doing our part by staying safer at home, we will save lives and move into the recovery phase by turning a dial, not flipping a switch, as Liska has mentioned. A few final thoughts. The local health department is your source for up-to-date, accurate information. Thank you for watching today and continuing to follow the Safer at Home order to help keep communities safe. I would now like to introduce KT Gallagher from Dunn County Public Health.
Thank you, Angie. My name is KT Gallagher. I am the Dunn County Health Department Director. Quickly, wanted to update on our Dunn County residents. We have had just over 680 people in Dunn County test negative for COVID-19. We still continue to have 9 Dunn County residents who have tested positive. 2 of those folks continue to be hospitalized. And we're following 3. So of the 3 we're following, 2 are hospitalized. 1 is isolating at home, following along with what the health department is asking them to do to keep them and their friends and family safe in our community. I want to echo the sentiments that you've already heard, that locally in Dunn County we are continuing to work so that we are ready to reopen safely by turning that dial instead of flipping the switch, having conversations with our business partners about what that could look like in all different levels of essential and non-essential businesses, and being planful about how that works in Dunn County. Also working with our law enforcement partners, because we recognize that we are safer at home. We need to work together in a concerted way so that we can keep our whole Dunn County community safe. Additionally, we're working with the other sectors about what that's going to look like in Dunn County today, 2 weeks, 2 months, as we turn that dial. I'm very appreciative for the folks that have reached out and have helped us increase our capacity at the local health department level. So for those that have helped us with contact tracing, people that have either volunteered through Weaver, the Wisconsin Emergency, I'm not gonna get it, I'm sorry guys, Volunteer Readiness Coalition, so you can go onto the Wisconsin Weaver site to sign up. Folks from our school district partners that are able to help us, either from a public health nursing or a school nursing background, as well as those in our health system partners that help us brace for readiness. In Dunn County, we do have a significant amount of testing. We're grateful for that. We are continuing to see testing of folks that are very sick. Additionally, people that are being tested prior to services provided by our health system partners. We need to increase the level of testing in Dunn County so that we can be ready to prevent illness spread to folks that are symptomatic but not meeting that threshold for really sick and hospitalized, or one of the prioritized tier with healthcare workers or people in congregate settings. Again, we need to increase testing in Dunn County so that we can be prepared to reopen safely by turning that dial. We continue to work across borders. When we have 9 confirmed cases in Dunn County, it doesn't mean that the work stops. We work across county lines so that we can be prepared to prevent spread by doing contact investigation and contact tracing for cases in other counties. The work continues. Finally, I want to thank you guys for staying home, staying safe, continuing to follow the Safer at Home order. I appreciate it. Thank you.
Thanks to both KT and Angie. We have a strong partnership in this area. We are fortunate for that. And I think you can see that the work that happens across our counties makes a difference. Makes a difference in the cases we're seeing, and makes a difference in saving lives and keeping illness as low as possible. An update from Eau Claire. In Eau Claire, we continue to have 22 confirmed cases, no increase from last Friday when I talked last. I'm really thankful for that. It has made a difference to have people stay home, to keep their circles small, and I'm thankful that we're able to report that again today. Our testing numbers are at 1,471 Eau Claire County residents tested for COVID-19, with negative tests and pending tests available as well. We have a call center that continues to take calls. That number is 715-831-7425. That is a place you can go to after you've looked at the website, where we update things regularly. And if there are additional questions that you have, that call center number is available. Again, the website is coronavirus.echealthdepartment.org. A couple of updates in addition to our numbers that have been happening. We have continued a lot of work in our spaces around planning for the next step, as Angie and KT also mentioned. We do have a task force that is building off a plan that was developed locally on moving forward. So we have a local plan, and now the task force is being put in place to implement that local plan. That really includes right now a look at having financial support for businesses, having business upstart support with both the health side and the economic side, and then to have strong communication about how we do this with businesses in a way that actually helps people feel comfortable working and feel comfortable going into businesses. We've had a lot of success already in Eau Claire, and I think across the state. Under Incident Command, we have a whole team that is working with our essential businesses right now to make sure that they're set up and operating in ways that keep their employees safe as well as keep their customers safe. So strong communication with places like grocery stores, places like churches, the voting that happened in Eau Claire County. Active engagement with all those community partners to do things in the safest and most effective way possible now. We know that as our businesses open up from where we are now, that work will continue and will be critically important. How companies really move forward with things like physical distancing and hand washing and monitoring symptoms of customers and employees, all those will make a difference in the next number of months in order to safely reopen, strategically reopen, and contain disease. Those logical next steps are things that we need to have in place, and we are confident will be in place in Eau Claire. We're also very closely working with the Eau Claire Chamber. The Chamber is having a business meeting tomorrow morning, for example, and I'll be at that talking with them about not only how do we reopen business safely, but how do we contain disease in our community. That partnership is critically important, and Dave Miner will be here on Wednesday to share with you more about the Chamber communication, the Chamber plan, and how we're together supporting businesses and doing this successfully. We know businesses have been struggling during this time. We want them to have a smart reopen, and our job is to support that successfully happening. The worst thing we could have happen is opening of businesses and then a lot of sick people. None of us want that, including the business owners. We also spent a lot of time with the state this weekend supporting their use of the White House plan and the American Enterprise Plan, both national plans for reopening, and communicating as incident command, emergency managers, and local health department directors that we needed those guidelines to be utilized as we move forward with next steps. So we're pleased at a local level that that's happening. In Eau Claire, we also have now received feedback from all of our various healthcare institutions that are doing testing about what their current capacity is and what their plans are for moving forward. That will help inform our next steps about what we do to support success, not only at a state level, critically important, but also locally. So we, as others have said, both KT and Angie, increasing testing capacity here locally is a critical piece as well for us. In closing, again, check our website out. Do call if you have questions. We're really fortunate that Eau Claire has been so successful in keeping our numbers very flat. We do have positive cases. We know that there are likely more cases in the community, but as long as our numbers are small and we've kept our circles small, we're containing disease, and that's important. We also have not yet had any deaths related to COVID-19, and that I'm very thankful for. We expect that likely will happen over the next number of months, but as long as we can protect people and have the capacity with our healthcare system to treat people, we minimize that risk. Thank you for what you're doing to be part of this, whether you're at home or you're working in an essential business or you're providing care in a respiratory unit. All of those roles are critically important. We will continue with the Monday, Wednesday, Friday media updates. So our plan would be to be back on Wednesday to, again, at 3:30, give you that update. Again, Dave Miner from the Chamber will be joining me on that day. And we are available now for questions. Yes.
Lisa, we talked last week about the need for more testing, and you guys reiterated it today. Mm-hmm. There were a few hurdles in place then. It sounds like today's news is taking care of some of that. Mm-hmm. But will there be, from what you know, will there be enough of the reagent or the swabs to really get this up and running?
Sure. So the question is really about testing, and do we have not only the capacity for more tests, but actually all the supplies, equipment, materials, people, all of those other potential hurdles that have to be overcome in order to have expanded testing. Of course, it's a complicated answer, and yes, the capacity has increased. The state has done a yeoman's job in a very short amount of time working on some of the pressure points. So working with Exact Science, working with Marshfield Clinic Health System, working with ProMega and other companies really does increase our ability to meet those challenges. Locally, it will take some time. So I think the other thing people have to understand is that tomorrow there won't be double the testing. Getting things in place, not only the people to do the testing, but the supplies here locally and the protocols changed will take some time. And we're seeing movement already with that happening. And we're really pleased that for some of the high priority tests in Eau Claire, even over this weekend, we had movement in getting some of those tests done in a very rapid way. So we are very, very fortunate with our healthcare system partners in this community. We have ongoing conversations and very open conversations with them. And we know that there are some barriers, but the improvements to the access to supplies are happening every day. So I think the announcements made today about some of the partners will only help with that. Yeah.
Could you please speak to the business people out there and maybe those employees who are not going to work, who feel like, hold it now, there's been one case in Eau Claire County in 2 weeks and we can't open our business and I can't go to my job.
Mm-hmm. So the question is for those communities, including Eau Claire, where there has been only one new case in the last week, and the concern that last 2 weeks, the concern that some business owners and people working in those settings who may not be employed right now might have about that. What we need to see across the state and the metrics that the president as well as the governor are now using for reopening for a state are really that we across the state have numbers of positive cases and testing numbers that indicate the ability to start reopening. And across the state, we are still seeing increased testing numbers. In this part of the state, we have seen increases very slowly because of the Safer at Home order. And what we need to understand is that the enormous increases on the southeast and the northeast side of the state that happened early on were because the disease started there earlier than here. The doors were closed to disease spread here before we started having additional context to cases that increased the spread. So we, in some ways, in this part of the state, are at more risk if we open without being strategic. And we have a safe reopening plan that slowly increases the potential for spread. I would anticipate that our counties, Dunn, Chippewa, Eau Claire counties, will see increases once we start progressively opening. But we hope that to be as flat of a curve as possible. We want to open, but we need to do it safely.
Today, the Tavern League of Wisconsin called on the governor's office to open bars, restaurants by May 1st if they implement, guidelines within their places, limiting the number of people that can go in, spacing tables apart so the 6 feet apart rule still applies. I guess what would your response be to that if they're trying to implement some of these strategies in place just a couple weeks ahead of the governor's?
Sure. So the Tavern League today announced that they want to open May 1st, and they would do that using a variety of measures to keep people safer. Certainly the measures that are being utilized across the U.S. and internationally around physical distance, number of people in spaces, monitoring for symptoms of both employees and customers, making sure that there are protective ways for people to decrease disease are all critically important and are part of the White House orders and framework as well as the Wisconsin framework. What we haven't had in Wisconsin yet is the ability, based on the clear criteria that have been put forward nationally, to say that we are in a point where we can start doing that yet. I know that the governor's office from today's briefing, and as well as public health officials across the state, want to move to that quickly. If we can do that in the next couple of weeks, I think everybody will be thrilled to start taking those smart and progressive and strategic steps forward. It's not about a certain date, it's about hitting metrics that show us that the disease is not widely spread. We'd love to be able to say that a date will make a difference, but it's really the spread of disease that's going to make a difference. Yes?
We've seen a few teacher parades, school parades put on throughout the Chippewa Valley. Can you comment on the legality of that and whether or not that's a good idea and whether or not?
Sure. So the question is about parades, particularly the question related to school parades or teacher parades. We are aware that some schools are choosing some educational strategies that include teachers providing some social emotional support, part of the educational strategies to their students by driving past homes. Again, it's allowable in the order to do that for educational purposes. Parades in general for just general amusement purposes are not allowable in the order. But the specific and narrow definition in the order of educational purposes being out in the community is allowable. We're working hard with schools to make sure that they understand the risk involved. Certainly as the weather gets better, the risk that we have, because teachers are well loved in our community, is that people will get too close. And so we are really working hard that our education providers understand those risks, are protecting against those risks, and only use strategies when they see no other alternatives to bring that kind of educational content to their students. We have great educators in this county, as do I'm sure all the other counties, and we know that they really want to be supporting their students. And the best way to support them is to make sure that they and their families stay safe. I think many people may have seen on social media that the teachers will do their job when they can get back into session and work with students. Families need to do their jobs keeping the community safe and getting us back to school as quickly as possible by staying home and getting the numbers of cases down. Yeah.
I asked you last week about protesters in Michigan. Now we've seen that happen in southeastern Wisconsin at the Capitol yesterday, and it seems like the largest one, and I'm hearing reports of people from western Wisconsin planning to go to Madison for Friday. So could you comment again, address what you observed from seeing that and your comment?
Yeah, so the question is really about protests that we're seeing around the state and also across the country related to concerns of reopening businesses and reopening the economy for COVID-19 reasons. Certainly, being able to have a voice in public space is an important part of being an American. That is a right that we all have. We also know that this disease is one that is unprecedented, and the measures taken are unprecedented, and that's hard on all of us. What we need as a community to focus on is how we make sure we can reopen as quickly as possible, and turning that light switch on, saying we're open now, will actually be much more devastating to our communities and to our businesses than doing it in a strategic and measured and planful way. We need to keep disease low, which is what we're doing now. We need to stop the increases in our disease trends in the state, which I think we're getting to the possibility of being able to do. And we need to make sure that we are safely reopening all those businesses, which take time. We need the equipment, the materials, and the understanding of all those businesses. And we've been working on that. Those examples I gave you in Eau Claire for grocery stores and the takeout restaurants, all of those things, that takes time to do well. And we want our businesses to be fully prepared to do that. Protesters, I think, importantly, need to understand that they put themselves and others at risk when they are gathering in a way that isn't honoring physical distancing. That is our best measure to prevent disease spread. Physical distance, washing your hands, not touching your face, those things at an individual level we really clearly can do. And those circumstances where that's not happening for whatever reason, we run the risk of not only getting the disease ourselves, but spreading it in our community to our loved ones. And I think people need to understand that and take responsibility for the risk that is posed with that kind of a practice. Yes?
You talked about several barriers to testing, lack of materials, shortage of PPE. Do you know if there are one or two or three particular pressure points to testing that we're seeing here in Chippewa Valley? Is there one of those that's really a barrier?
So is there a particular pressure point to the increase of testing here in the Chippewa Valley? Actually, some preliminary maps that the state has worked on to look at testing across the state and our capacity for testing, the Chippewa Valley actually looks pretty good compared to some areas. We have providers that are at a rate level per 100,000 people. The number of people that have been tested is actually better than some other parts of the state. So we are fortunate in that regard. The biggest issue that we are seeing locally, I believe, and from the feedback that I've gotten from all of those providers, is really around some of the testing supplies, some of the reagents. So not as much around having the capacity to do the work, but we only very recently opened up the criteria for testing. So that really was just last week, even though it's hard to believe that. So it takes a little bit to get those changes into their systems, and they are working through that. So that's a short-term barrier, but I'm confident that they are finding ways to consider that. And then the additional barrier really is some of the supplies needed to do the actual lab work. And I'm, with the work that the state's doing, they are paying very close attention to that. That's an issue across the U.S., not just in this community or in this state. And our state lab leaders are working hard on that.
The governor introduced the Badger Bounce Back Plan today. I mean, how long have you known about it, and what's just kind of your general overall view of it?
Mm-hmm. So the governor introduced the Badger Bounce Back Plan today, and the question is, how long have we known about it, and what's our general thoughts on that? We received the plan at the same time everybody in this room did, and everybody that is now aware of that plan. So the final plan we did just receive. Looking at that plan, it includes the principles that we've been talking about for many weeks now. So I think the surprise is not there. Over the weekend, we spent a lot of time talking to state officials at a local level, encouraging the use of the White House plan that came out last week, encouraging the use of the American Institute's plan that also uses the same principles around testing and having strategies to progressively move to reopen and contain disease. So none of the pieces, as I've quickly looked at the details of the plan, are surprising. They make sense to be strategic and to think about containment. Wonderful. Thank you, everybody, for joining us today. We will be back on Wednesday, and we look forward to updating you then on what the current status of COVID-19 is in our community.